Hi, Jackie Van Ruler here, and in today's video I'm going to be talking about the knees. This is a great video if you have anything at all going on with your knees, whether it's swelling, pain, an injury, arthritis, even long-term knee issues. A lot of times you can make a lot better through facial reflexology. And you might even be able to avoid surgery in certain conditions, or by doing this you can make the surgery go better because you're already getting the body into a better state of health prior to going to surgery. So we're going to start with our kidney points. Fingers on the corners of the mouth, all the way up to the forehead. Come down just a little bit. The kidneys have a lot to do with the knees, the ankles, the wrists, the hips. So any sort of a joint that it can easily get stiff, stagnant, or swollen. The kidneys nourish your connective tissue, keeping things moving smoothly and freely. And so a lot of times when you have knee issues, working the kidney points are going to help to improve that connective tissue hydration so that things move more smoothly without stiffness or pain. Okay, then we're going to do some knee points that are halfway between your inner brow and your forehead. So we're going to be right in here. So notice if these points tend to be stuck or stagnant. If you have any facial anomalies in this area, such as a mole or dark spots or anything like that. Notice if this feels stuck or stagnant. You want to work this on a regular basis. You can do this formula up to 4 times a day. So if you do have some serious knee stuff going on, I would definitely work it as often as possible. Next area we're going to work is this whole area of the bottom of the nose. And this area has to do with the kidneys again. Also point for the hips. So if you have knee issues, you probably have your hips out of alignment as well, just because you're either compensating with the other knee or the other leg, or it could be a hip, hips being out of alignment that have caused any injuries. But either way, you're working the kidneys. The kidneys again are going to hydrate that connective tissue and make things move more smoothly and easily. Okay. Next area we're going to work is this area right in the center of the smile line. This is a point for lubricating your joints, particularly lubricating the knee joint. And then you're going to come over a little bit onto that upper lip to get the adrenal glands. These 2 points together help to decrease inflammation within your body. And a lot of times when you have knee pain, knee swelling, you just have a lot of inflammation in that area. Working in that smile line. And then we're going to work from the corners of the mouth all the way to the ears. So this whole area in here, this is a knee point, particularly the back of the knees. So if you have a lot of lymph stagnation in the back of the knees, that's a great area to work. And then this whole area in here is any of the joints of your body. But particularly if you have knee issues, you might notice that you have a series of wrinkles that come out onto your cheekbones in there, and that's really common when people have a long-term knee injury, that they might have that going on. I did have a client who had a knee replacement, and on the side that she had to have the knee replacement on, she had those that several string of wrinkles in that area. So all the way to the ears, and if you're finding spots that are more tender or tense or zingy than other areas, just work it a little more specifically. Like I'm noticing it's a little tight right in here. But as I move out over here, it moves fairly freely until I get to here. And then I can go all the way to the ear. Okay, working that on the other side. It's always good before you start this to think about what is the pain or the discomfort that you're associating in your knee on a scale of 1 to 10. And I'm feeling a little bit of tenderness right in here. I'm going to stay there for a second and then move on. So what is it before? And then think about after. Did it go down? Did it decrease? Are you feeling as much pain, or has the pain gone away completely? Also notice if you have swelling, how swollen is it? So by doing these things, you can help to gauge how well it is helping. With the knees, because it has to do with the kidneys, The kidneys always take time to heal, and so a lot of times it just takes more time and more effort to heal things that are associated with the kidneys, such as the knees. Okay, then we're going to work the 2 points under the lip and coming down to the chin, and this is helping to decrease any inflammation. This is a diuretic point, and so it helps to get rid of excess fluid in the body. Coming to the other side. So if you tend to have a lot of swelling in your knees and possibly your feet, this is a good area to work for that. And then coming down onto the chin, and this is a point for the bladder. And then, of course, with every video, we're going to finish up by working around the ears. So coming to the top of the ear, working down the front side, up and around. And again, please don't hesitate to do this up to 4 times a day. It may help you to avoid surgery or other medical procedures. And even if you do end up having to have surgery because of knee issues or knee pain or arthritis or bone on bone, then this will help you to heal much, much, much faster, because you'll be going into the surgery with knees that are already energized and receiving the nutrients and the energy that they need. As always, please make sure that you're subscribed to my channel so you don't miss out on any of my videos. Like this video, and please comment if you noticed a difference. And even if you didn't, please let me know. Sometimes more specific things will have other issues going on. And I did forget one point here, sorry about that. We're gonna do the liver point, right hand side of the face, in line with the bottom of the nose, directly under the iris of the eye. The liver point is going to be specific for if you have an injury of the ligaments or tendons of the knee. So if you have an ACL or MCL injury, the liver helps to deliver cholesterol to hydrate and moisturize the ligaments and tendons so that they are more flexible and don't snap or break as easily as they would otherwise. You can always do a point after you do around the ears. It's not a big deal, but if you want to, you can go back and work that front side of the ear again if that feels good. Thank you for watching, and I will see you in the next video.